I'm going to show a videotape of some of the cases that we've seen with 3D color. This is a endometrioma with kind of diffuse echogenic content. What we're doing first is scanning throughout the plane and seeing areas of vascularity. Here on this 3D volume, we're seeing that there are only a few vessels in the periphery of this lesion. None of them, in fact, are coursing toward the center of the lesion. So this is an example of a benign lesion. This is in the other scan plane. And I'll show you the next case, which shows abnormal vessels coursing toward the center of the lesion. This is another 3D color Doppler done transabdominally with a freehand technique. We're imaging through the ovary here. We're finding an echogenic papillary area, and we can see that there's a small vessel going to it. When we post-process this image, we can see that there's a large vessel going to the area of abnormality right here, which supplies the ovarian cancer. Uh, 3D is very helpful in evaluating tubal disorders, as I mentioned. This is a 3D image moving in all scan planes, showing that this tubular structure seen in the long axis, short axis, and the coronal plane is arising from the corneal area of the uterus. And the 3D scan plane again confirms that this indeed is a hydrosalpinx as opposed to a cystic ovarian lesion using 3D. This is an intramural fibroid with peripheral vascularity. This is prior to embolization, and one can see that as opposed to an adenomyosis where the vessels are diffuse, this lesion has a peripheral vascularity. I'll show you some of the vessels supplying this fibroid. We're going to select some of these scan planes to show this shows the significant amount of vascularity all surrounding this fibroid. This is the combined sample volume showing the large peripheral vessels supplying this fibroid. We can take this sample volume, we can move it in any particular scan orientation. We can slice and dice it, and we can evaluate its overall vascularity very nicely using this 3D technique. Here we're just showing the sample volume and the vascularity surrounding this fibroid. We can remove the grayscale and look at the vascular tree. And we can follow many patients that have had uterine fibroid embolization and may have complications after that for the overall vascularity. And here we'll take off the grayscale and show you the vascular network surrounding this fibroid. Then we can put back the color Doppler. This is an example of an endometrial polyp and the vascularity in the endometrial polyp that was a malignant polyp. And I hope you can appreciate the vessels being very abnormal. There's areas of dilatation and narrowing, and there's abnormal branching inside of this polyp. And we can appreciate this because we can have a display in 3D of this vascularity inside of this polyp. This is a patient that had a lesion in the ovary, and the 3D was very helpful in showing the central location of the vessels as opposed to a benign lesion. Here we have, again, a mostly solid lesion with some cystic spaces, and all of the vessels here are shown to be abnormal, supplying the center of the tumor. Here are the multiplanar images that were obtained, and again we can see that the vessels course toward the center of the lesion right here. This is in the coronal plane showing the location of these abnormal vessels. This is the sample volume where we can see the relationship of the vessels to the morphologic abnormality. These are all abnormal vessels in the area of thickening inside of this lesion. And this is the vascular cast image of these abnormal vessels. This is the lesion that I showed on the earlier portion of the talk. This is a large tubo-ovarian abscess, and here are the abnormal vessels, and we can see the 3D volume here. I was asked to aspirate this lesion, but I wanted to show them the vessels that may be traversed, and this 3D was very helpful to convince them not to pursue aspiration of these lesions. And here we cut the top of the lesion bloodlessly, I must add, that then we take the volume and tip it, and we can look into the lesion, and we can see that yes, I could aspirate a few of these small locules, but the needle would be traversing all the vessels inside of this tubo-ovarian abscess, and that would not be a great idea to perform it. So it's very helpful in identifying the proper route for placement of needles and aspiration. Here we're putting back the tissue that we removed. This is a 3D image. As I mentioned briefly, we can use fluid in the lumen, and we can identify beautifully the polyp and its vascularity. As we can see here, the vessels inside of this polyp are seen and are better seen with 3D representation. So the polyp and its vascularity are seen very nicely with this technique.